Conditions that we treat in the shoulder surgically have a wide range, and I was going to briefly talk about a few of these conditions. We've rotator cuff tendon tears at this day and age are more often than not treated with shoulder arthroscopy, where arthroscopically we can see all four of the tendons from the front, top, and the back and reattach those tendons. The advent of shoulder arthroscopy really allowed us to really look at the geometry of these tears to make sure we get an anatomic reattachment of the rotator cuff tendon and even diagnose rotator cuff tendon tears that weren't seen before. In addition to rotator cuff tendon tears, labral tears are common in the shoulder. Labral tears are inside the ball and socket joint, and in fact some of the labral tears were never even diagnosed before, particularly a slap tear, superior labral tear, where the biceps tendon attaches to the labrum. The advent of shoulder arthroscopy, not only did we start seeing these conditions as pathological and painful, we're able to classify the type of slap tears we have and treat them appropriately. In addition to labral tears and rotator cuff tears, other injuries that we treat are instability in the shoulder joint, where the ball actually pops out of the socket or dislocates or partially dislocates, and patients have dysfunction, inability to use that arm, continued pain, not having a stable fulcrum where the ball moves on the socket. Again, arthroscopically, we can really reattach everything, not only the labrum back to the bone in an instability situation, but we can also arthroscopically tighten up the ligaments that may have stretched out, and sometimes the ligaments actually tear off on the ball side of the humeral head, oftentimes referred to as Hagel lesions, which can also be addressed arthroscopically. Other conditions that we treat in the shoulder arthroscopically is pathology or partial tears or tendonitis of the biceps tendon, where we can release a biceps tendon like a biceps tenotomy procedure, or we can release and then reattach the biceps tendon called the biceps tenodecies. Another injury that we oftentimes see in patients that are falling from a height or land on the top of their shoulder or in a contact athlete are acromioclavicular joint or AC joint separations or sprains. More often than not, these patients are successfully treated non-operatively, but in those with very significant injuries, we can now arthroscopically reconstruct the ligaments that bring the clavicle or collarbone back in line with the rest of the shoulder and the shoulder blade. These are a few of the conditions that we do treat arthroscopically, and we've had excellent outcomes in treating them.